MCQs for the OSCE. So shall we start with the OSCE? I think lag hai thoda sa. Okay. Please don't raise hands. Please ask, put your questions in the chat box. Whatever we are able to see, I'm able to answer that. Otherwise, it will be difficult to unmute you. Okay. So the first is the division of zygote before which day of life results in diamniotic dichorionic twins. Is it 2 days, 3 days, 10 days, 14 days? Any idea? Somebody in the chat? No one? So before day 3. So this is the chronology actually. So before day 3, if the zygote divides, then the chorion will be separate, dichorionic diamniotic. And between day 6 to day 8, the twin pregnancy can be either monochorionic diamniotic or monochorionic monoamniotic. And if it is beyond day 12 to 14, then actually it can be a conjoined twin. The same thing actually I wanted to show in a pictorial form. So within 72 hours, dichorionic diamniotic placenta would be there, and it's about 32% of the twins. And if it the division occurs 3 to 8 days later, then it will be shared in the form of monochorionic diamniotic. And the longer it takes to divide, the more fused the babies would be. So 12 to 13 days later, it would be a conjoined twin. Okay, identify the sign and underlying pathology in this X-ray. Anybody? Sayuri? What do you see? No one? You're able to see the screen now?
Yes, ma'am.
So what is this, Lucency? What is this happening?
Ma'am, that's the thymic shadow.
Which is pushed up, no? Thymic lobe.
Yes, ma'am.
So it is a pneumomediastinum. It is called a Sale sign or a Spinnaker sign. Okay. So Sale sign is when the air collects and the thymic shadow is shifted upwards. So both in the AP and the lateral view, you can see that there is a pneumomediastinum. Okay. So what are these lesions? Can you name 2 possible underlying causes? No? Blueberry muffin baby, have you heard about that? So it's a blueberry muffin rash, and it appears with multiple raised cutaneous lesions, and it is due to extramedullary hematopoiesis in the dermis and seen in CMV, rubella, and hematological dyscrasias. So this is the intergrowth chart which you all must be familiar with. At which postnatal age do the charts overlap with WHO charts? And which city was a part of this study? Anybody in the chat from the participants? Itna tough hai question. They overlap at 64 weeks postnatal age, okay? At 6 months corrected age. They overlap with the WHO charts. And the center which was there for intergrowth study was Nagpur, Maharashtra. What is ETTNO trial? None? No? Okay, it's about the blood transfusion in preterm babies, restrictive versus liberal transfusion, okay? So effect of liberal versus restrictive transfusion thresholds on neurocognitive outcomes. So this is ETTNO, effect of restrictive transfusion thresholds on survival of and neurocognitive outcomes. So it showed that whether you give at low threshold or high threshold, the neurodevelopmental outcome at 22 years was same. So one should be actually restrictive in giving blood transfusion. So this was a landmark trial. And another landmark trial was NIH, transfusion of prematures trial, top trial, okay? This was the NIH trial. Anybody can identify what this graph represents? Just guess in the maybe in the chat box. None? Anybody can answer this? Sayuri, ventilation, crafts. So it indicates inadequate flow or air hunger. Okay. So you know what is this run chart used in quality improvement studies? Have you seen? No. Okay. So this is a run chart which we use in QI studies. If you some of the units must be doing. So this is known as a shift, in which there are 6 or more points which are just above or below the line. So these are known as shift in the run chart. Okay. The other rules are trends and the astronomical data. So it may come as an MCQ. You should know what is a shift and a trend, and what is a run chart. What are the rules of run chart? You should be able to know. This is one of the health programs. Anybody? What is Mission Indradhanush signify? Which health program does it cover? I'm not able to see the chats actually. Yeah, vaccination, right. Good. So this is about the vaccination launched in 2014. And intensified Indradhanush was launched in 2017. Okay. So it covers against, it started with 7 diseases. That is why Indradhanush. But then additional diseases were added like encephalitis, hemophilus type B. So firstly, the primary diseases ko they aim to cover. Okay. Right. So what are these cells? This is about the surfactant production, okay, in the body. So I'll just give you the clue. So which is this cell and which is this cell, the smaller one?
The
Yes,
first is type 2 pneumocytes.
yes. So these are the type 2 alveolar cells, which actually are responsible for surfactant production. And this one is alveolar type 1 cell, which is responsible for the gas exchange. Okay. One statistics, a student collected data to determine the factors which affect the birth weight of a newborn. So a statistician told him to apply chi-square test. So which of the following variables will you apply the chi-square test on? Mean hemoglobin level, height of the mother, gender of the newborn, gestational age in weeks. Yes. So chi-square test is for categorical variable. Yes, no में जो answer होगा, that will be actually tested with the chi-square test. So gender of the newborn. Rest of them are quantitative data. So just if it comes as an MCQ or a question, you should know categorical versus categorical. We use chi-square test mostly and Fisher exact test. And if they are related or pair data, like before and after, then we can use McNemar test. Quantitative ke liye, you all know that parametric, non-parametric. So this, everybody must be having their own flowcharts for this test of significance. So student t-test, pair t-test. If there is a non-parametric, then Wilcoxon ranks them. So these things you should know. Quantitative versus quantitative, we usually do a Pearson correlation or a Spearman rank correlation test. Yeah, just wanted to orient you to different topics.